Let's go to Congresswoman Nan Hayworth, who's been patiently waiting for us. Good morning, Nan.
Good
How are
morning, Doctor. I'm well, Dr. Siegel, Dr. Samadi. It's a real privilege to be on the radio with you.
Well, thank you so much for being here, and we need your input. Last time I met you and I saw you, we were on Fox News when you were running through the campaign, and you did a superb job, and I congratulate you for everything that you've done. Before we get into it, during the commercial, I was talking to one of the producers here, and I said, a lot of doctors are going to politics. We see Dr. Ben Carson. We see so many other doctors going in.
Sure.
And of course, you like yourself as an ophthalmologist,
Yes.
And you made a big difference. What happens if you decide to come back?
Well,
What happens to the practice? I mean, I don't know the answer, but is the practice still there, or you have to start from fresh, or?
Well, I actually, in my own case, in 2005, I left clinical practice after 20 years of caring for patients. Great privilege to do so. And I had two sons at home. My husband is also a very busy physician, and I decided that I'd better defer to the needs of motherhood. But I'll tell you, I've been involved nonetheless passionately in trying to, as we all know, and I was privileged in 2010, I was the first female physician, the only one, elected a member of Congress, because this is our mission. This is your mission, Dr. Samadi. This is why you're doing what you're doing. We want to see the blessings of innovation, of technology, of expertise provided to every American. And instead, Obamacare, in one sentence, if you will, is $1 trillion gift to the insurance industry and government bureaucracies.
Let me ask you something. Obamacare, and when he was talking about this, and I really haven't gotten into the politics of it, because I think when you're practicing in major hospitals, I don't want to mix politics with medicine, but you're in a different position. He came and he said that, once you join this Obamacare, you're going to be able to choose who your doctor is. We're not going to change, and we're not going to have a single payer. And what has happened, especially this year, especially starting in January, there's a chaos. People don't know what their premium is. They come in and they book something, and then they cancel because they're confused. Doctors are confused. I know Mark probably has the same kind of problem. And we're speaking on behalf of all the doctors out there. We're just example of few here in New York City. Did he lie? Was this like a slow way to get into one system healthcare?
Well, I think clearly it was almost as cynical. You hate to say it, but you could look at it in the way things have turned out. People were promised by the president, if you like your doctor, you can keep your doctor. Well, that absolutely hasn't been the case. If you like your insurance, you can keep your insurance. Nothing of the sort. And what happened with Obamacare is that it was, either the president was blissfully unaware because he just simply didn't care about the details, or he overtly knew that what was going to happen was that everything was going to be thrown into chaos, because the vast majority of Americans had health insurance that worked for them. Was it perfect? No. There were a lot of things we needed to do better, but none of them were provided for in Obamacare.